What's in a name? The difference between counselors, therapists, psychologists, and psychiatrists. Marriage and family therapists, MFTs, licensed counseling social workers, LCSWs, psychologists, PhDs or PsyDs, provide talk therapy to help treat and prevent PPD. Find one that has particular expertise in perinatal mental health. Talk therapy has been proven to help PPD. In fact, it's first-line treatment for mild to moderate PPD. However, therapists cannot prescribe medications. A psychiatrist is a medical doctor, MD, who's trained to treat mental illness with appropriate choice of medications. Some are also trained in psychotherapy. They can provide medications to improve your depression, sleep, anxiety, or other disorders as needed. Medications are considered first-line therapy for moderate to severe depression or anxiety. However, the combination of therapy and medications has been shown to be more effective than either treatment alone. Medications. If you have depression in pregnancy, the decision to take an antidepressant can be difficult. You may feel like you're the only one taking meds for PPD, but you aren't. 7 to 13% of pregnant women in the United States take antidepressants. That's about 1 out of 10. Women don't often talk about taking them for fear of judgment. Similarly, many people avoid taking them for fear of how medications will affect their babies. Today, we have decades of pooled data following women and babies exposed to medications during pregnancies. Through this data, we have learned that many antidepressants are safe to take in pregnancy. The right medicine will help you feel more like your old self again. This is a discussion to have with your prescriber about the risks and benefits. The most commonly prescribed class of antidepressants used to prevent and treat PPD and PPA are serotonin reuptake inhibitors, SSRIs. Most SSRIs have been shown to be safe in pregnancy and breastfeeding. They are not addictive. They improve a woman's responsiveness to her baby. They can help her bond with her baby. One SSRI commonly used for pregnancy is sertraline. The brand name is Zoloft. Studies have found that starting sertraline prophylactically prevented PPD in women who had PPD with a prior birth. Not only was there a dramatic lower rate of relapse when used prophylactically, but those women who did not take this medication relapsed much quicker. If you have moderate to severe PPD with a prior pregnancy, prenatal care providers will often recommend starting a medication about a month before your due date. Brexanolone Zulresso is the first medication to be FDA approved for the treatment of PPD. It works by replacing levels of allopregnanolone, a metabolite of the hormone progesterone. Your level of allopregnanolone drops precipitously after giving birth. Low levels of this hormone have been shown to correlate strongly with depression. Brexanolone requires a 60-hour-long medically supervised infusion to be given, usually in the hospital. It is used when symptoms are sudden and severe, or when other treatments haven't worked for someone in the past. It has been shown to dramatically improve PPD within a couple days. Frankly, that timeline is remarkable. However, antidepressants are not risk-free. Different medications have different side effects and different safety profiles. It's beyond the scope of this course to discuss them all in detail. New studies investigating the safety of various medications is being done all the time. Recommendations change based upon these studies and the information available. A perinatal psychiatrist will have the most accurate, up-to-date safety information. In deciding whether to take a medication, recognize that you are weighing the risks of taking it against the risk of untreated depression on the baby. If you recall what was discussed in Module 3, you'll have a greater understanding of the fact that the harm of not treating PPD usually outweighs the risks of taking medication. However, The decision to take medications is a personal one between you, your partner, and your doctor. If you'd like to do some preliminary research, a website that is accurate and very informative, specifically when it comes to taking medications during pregnancy or while breastfeeding, is mothertobaby.org. This free site has fact sheets on the safety of each medication. They even have experts you can chat with. If you are looking for information about a specific medication, this is the place. As we well know, there's a lot of inaccurate or biased information on the internet. That's why it's between you and your mental health provider to come up with the best treatment plan together.